Hello dear viewers, in one of the videos on pregnancy I discussed the changes that occur in the cardiovascular system during pregnancy. In this video I will talk about the respiratory system. I'm Dr. Olena Berezovska and I welcome you to my video channel. Don't forget to support me by liking, subscribing to my channel and writing comments. The respiratory system undergoes significant changes during pregnancy. Progesterone stimulates the brain respiratory center directly, so expectant mothers become very sensitive to a lack of oxygen, or rather to an increased level of carbon dioxide. It is not surprising that some women are faint in crowded, stuffy rooms. Pregnant women's oxygen demand increases by 20%, whereas lung ventilation increases by up to 50% in 1 minute as pregnancy progresses. If a pregnant woman does not spend enough time outdoors, her body suffers and it goes into the oxygen starvation mode, which causes her to feel unwell. The developing fetus also suffers as it receives oxygen through the woman's body. As the uterus grows, the volume of the lungs decreases, and by the end of the pregnancy, the diaphragm level increases by approximately 40 centimeters, compressing the lungs. This is why pregnant women's breathing becomes more frequent and shortness of breath occurs, which in turn increases the risk of infectious diseases such as pneumonia and pleural effusion. If a woman smokes, the oxygen saturation of red blood cells is significantly reduced, which affects fetal development. In mothers who smoke, the fetus may be small, the placenta undergoes several changes, and premature births are more common. We'll talk about smoking during pregnancy in another video. Many pregnant women complain of a stuffy nose, which is why doctors often look for infectious and prescribe medications. However, elevated progesterone levels lead to swelling of the nasal mucosa, which manifests itself as a feeling of stuffness, making it difficult for a woman to breathe through her nose, especially at night. In such situations, nasal drops can be used to treat runny nose or nasal congestion. Most of these medications are safe and can be used several times a day. 40% of pregnant women can suffer of gestational rhinitis or runny nose of pregnancy. You will learn about the changes in other organs in the new videos. All the best. See you soon.